even higher.
Yeah, and one company created a new process that makes the testing easier and more affordable for the public. Patrick Sullivan, CEO of Oceanit Laboratories, joins us live now in studio tonight to explain. Patrick, thanks so much for being here.
Thanks for having me, Mika.
So why don't you start off by explaining exactly, it's a saliva test, how do they work?
Well, so normally what you do is they put the sticks up your nose and they take a sample and then they put it in some solution, and it takes hours under the best of conditions and maybe days to get an answer. We thought that's good for a forensic test if you're sick and you kind of know you're sick. But the problem with a pandemic, especially this one, is COVID-19 the virus is very clever. So you get sick around asymptomatic and pre-symptomatic people that would unwittingly expose you without really wanting to make you sick. And what that means then is that it's very hard to get it under control. So we came up with a design based on a technology we started probably about 6 years ago using artificial intelligence to deal with viruses and cancer and other things, and applied it to this. Took about 2 years of work, crunched it into about 2 months. And we thought it has to be easy, simple, affordable. You need an answer right away. We call it ASSURE-19. So you basically spit in a cup, shake it, pour it in, and you get an answer in, we say, about 10 minutes. The actual test is based on a molecule that is engineered for purpose. So it's specifically engineered to look for a piece of the virus, and it latches onto it kind of like a lock and key. So that's how it's designed. And so it's very specific. We're just getting started to do testing with patients, with queens. We've done some collaborative work with the University of Hawaii. They've been great to work with. The way we did this is like a 3D printer. We print it, and we test it, then we print it, then we test it, and we optimize it. And that's how we got to today.
How accurate is this, and could this be a testing that's going to be used widespread in Hawaii?
The hope is that it's accessible and widely used in Hawaii. It's actually pretty accurate, not as accurate as a PCR test. So a PCR test, in the medical terms, you talk about sensitivity and specificity. So it's very specific to the virus. Sensitivity, it's not quite as much. So if you get sick, you're around somebody that's sick, if you take a PCR test and our test will show you the same kind of result as you're producing more virus. You go up this curve, and you'll probably show it within about 6 hours of the other, sensitivity. So it's really pretty good, actually. And for purposes of managing a pandemic, we think it's really the tool that's needed. You can actually open up the state, bring businesses back, bring tourists back, that kind of thing.
And we did mention that it's affordable, which is a huge thing for a lot of people right now. What kind of costs are we talking about?
Well, we say $20, but we think in bigger volume could be less expensive. The cost is actually relatively low, but you've got to put it in plastic and paper, labels, and all those other things. You have to have an FDA-approved manufacturing process, which we want to build right here in Hawaii. So we want to supply Hawaii with technology built in Hawaii and manufactured right here. Then from here, we can scale it up to the rest of the world. So it's kind of the inverse of what a lot of people think of. It's from Hawaii to the world versus from the world to Hawaii.
Will there be enough? If this does go, and first off, I'm running short on time here, but are you in talks with the Department of Health?
Yes, but mostly the technical people. We proposed what's called the Aloha Protocol. It's an idea about testing over several days in a row. And if you do this, you can eliminate infectiousness. So it's a different way to think about how to manage a virus.
And the second part of that question is, we've seen shortages of testing supplies coming into Hawaii. If this does get approved and originates here, would it be used widely here? Will there be enough supply to be used here first off and then shipped out to other places who order?
That's the plan. So we think we can produce 25,000 a day in 90 days. That's what we're aspiring to do.
So we could potentially see this if it gets approved within 90 days. Super interesting. And if you missed any of this interview, of course, we'll put it up on KITV.com a little bit later tonight. Patrick Sullivan, thank you so much for joining us. We appreciate it.
Aloha.
Well, more than